going to call the insurance committee meeting to order. And I'm going to turn it over to Michael.
So if you all, so we had a meeting, I apologize, I'm remembering what we had discussed back then about how, there could be a potential for savings if the county was looking at streamlining its Medicare Advantage plans. Currently, the county has 7 Medicare Advantage plans, which would vary from different types, of services that are provided. And what we had asked for was certainly the Achianis, again, did an excellent job of going back to our providers, information, potentially on a one plan that we would be able to offer that would allow for to have, not really a change in service. And then in addition to that, to kind of earmark some individuals that already may be eligible to go with a different type of plan in order to be able to keep them at a no cost as well. Okay, so with that, Lori Halstead, amazing as always, gathering all the information from our office and working with the Achianis. So I'd like to turn it over to Steve and to Lori, please, to be able to kind of do their presentation. They've got some information here and allow you guys to ask any questions that you may have about me before they get. Okay.
We've had Medicare Advantage plans since 2003, and they really became popular in 2006 when they added the prescription drug. Then the county changed its policies where you had to leave the active plan and go on the Medicare Advantage plan because they were about 50% less expensive. And so that meant that anyone who was retired, you have to be retired and eligible for Medicare, which means generally somebody who's 65 plus, but can also be somebody disabled, has to go on Medicare, a Medicare plan. The reason we have so many, just briefly, is because there was cost savings. There was a little cost savings here, a little cost savings there, and any place you could find cost savings, we would do it. So this is why we have, and Rick Keaveney complained about this endlessly for every time he sat down.
Can't wait to tell him.
We'll call it the Keaveney plan.
Yeah.
He's the one that's going to complain because he's out of state, probably. In any case, you might remember we went out about 1.5 years ago and we came back with the choice of Humana as our best choice. It was either Humana or Aetna. We no longer use Humana because they did not come to an agreement with Albany Medical Center. And so Albany Medical Center is out of the network, and that struck them out. So the least expensive plan we came in by far was a plan from Anthem. You may not know the name Anthem, but it's Empire Blue Cross. The parent company is Anthem, and there's another parent company about that called Elevance. Anthem is who supplies the state plan together with United Healthcare. They do half of it. So we told them they had to make an exact copy. And what you see here is on the left side is where the bulk of our population is. It's on the MVP USA Care. What that is it's what they call a passive PPO. It has a network, but any Medicare doctor in the country will be reimbursed, so you can go to any Medicare doctor. So if you go down, pretty much on every line, they're pretty much exact copies of each other, and that's what we asked Anthem to do. The one thing is I put the $200 reimbursement for inpatient hospital care because we talked about that internally, and it saves so much money. It was like $15 per person. We decided that we would add a copay for hospital and then just reimburse it.
Like we do with all of our coverages now for our traditional commercial plans.
And so the big things that cause problems on these types of plans are network. And the network is not a concern because Anthem has, believe it or not, contracts with every hospital in the upstate. And nearly every doctor works for Aqua Hospital. And they have all the local hospitals. And as far as we can tell, they have all the local doctors also from the checks that we did. The other issue is prescription drug. What does the formula look like? And so we ran an audit of the top 25 generics, top 50 brand names, top 50 specialty drugs. And they're virtually duplicates. There are going to be some differences. In some places, they will substitute one drug for another drug, but their pre-authorizations are approved at 90%. I was told. That's not official. They can't say that out loud, but any pre-authorization, it's not on the formulary. Doctor says they need it, they will probably approve it. So this is what you call an open formula. Basically, use the drug you need. So with all those questions answered, we were like, okay, this looks pretty good. What price are you going to give us? So if you go down to the bottom, and Lori's going to give you over the 30,000 foot view, but if you just look at the all the way to the bottom, three from the bottom, it says rate. The current rate with MVP is about $400. The rate that Anthem is proposing, if we do it in August, it's $232 and $237 if we do it in September. And keep in mind that MVP is going to go up. We're guessing quite a bit because of the change of something called the IRA, the Inflation Reduction Act, which has changed Medicare profoundly. The biggest change the IRA has done is it's getting rid of the donut hole, which everybody's complained about. It's putting a hard cap of $2,000 on your drug price. Before there was no cap, right? And so this is increasing their costs dramatically. So you're going to see plans that are on now go up quite a bit. Some of them are expecting to go up as much as $100.
Do they already factor that into these numbers? Anthem has?
The way what Anthem has offered us is an 18-month guarantee on just the medical part. But since they don't know what the drugs are going to cost, they have to give us a different price on the drug part. They anticipate, straight from right from their mouth, a $20 to $30 increase. So instead of this $232, we'll have $260. But the difference still will be about,
Substantial.
yeah, still will be about half.
But still could be, it's not guaranteed that our other plans would not experience the same increase. So we could be doing that or more.
A lot of
Or greater.
Right.
A lot of companies are not even quoting because they don't know what,
They don't know.
they don't know what's going to happen.
And I just want to point out that the reason that the assessment for MVP included on here is because that's our largest enrollment. That's the plan that we have the most people involved in.
So Lori's going to give you a 30,000 foot view.
Thank you, Lori.
I am.
Are you page three?
I am page two.
Okay, that's what I
It's
thought.
draft.
So on the top, I just wrote down of how many people are in what plan and the cost for each plan that we have and our yearly costs, monthly costs, yearly costs that we pay right now. The middle half is if we didn't do the $200 inpatient reimbursement, we had a different rate and the savings that we would have per month per year for the 5 months for the rest of this year. On the bottom is the plan Steve was talking about with the $200 inpatient copay that we would reimburse.
The total savings is at the bottom. That correct? The 425.
Right, because if everyone submitted their inpatient copay for reimbursement, they estimate 10 to 20% of people do an inpatient stay during the year. So we did the high, we did 20%, 77 inpatient stays for the year. At $200 piece, if everyone submitted that $200 reimbursement, we would still say $425,000 for the year.
So, I mean, it sounds to me like it's a no-brainer. What is the,
And just to be clear, the reason the new plan for the Anthem Empire Blue Shield does not, currently that plan is a zero copay for the hospital in-stay, the inpatient. So,
Right, I should have explained.
no, that's fine. That's
Which
what I'm
is?
asking. Which is, it's zero.
which one? The
And
MVP?
the current one that
Oh,
they have,
yeah.
exactly. So by switching to this plan, that was going to switch now to a $200
Right.
copay. So that's why we inquired and they did all the research to see what exactly it would cost us if we offered that as a benefit to ensure same coverage. Because it is something certainly when someone's admitted to the hospital for them to not have an additional $200 copay. That is how we handle all of our traditional plans. They are reimbursed through the county at a $250 because that's what the plan's copay is. This is $200 and it's still the savings. That's the difference between the two numbers.
So that number's still factored in the $200.
Absolutely. And that's, so could you just go through that, what those two numbers are for them?
The numbers for what?
That's your whole, that's your copay here
I'm
is
behind.
with the 200, the $2,000, the $200 copay. I got it. Can't speak it.
So I'm just behind a step because it looks to me like with the $200 copay, the savings is higher than without it.
Those are expenses.
Oh, those are expenses.
Were you looking,
Correct?
Brenda?
You're not
The
saving.
$200 copay, without the $200 copay, we'd save 387.
Right.
With it, it would be 441. And if everyone submits, if all 77 people put in for reimbursement through a $200 copay,
It's still more though. It's 425 versus 387.
right, more of a savings,
Okay.
right?
So it just is counterintuitive to me that we're paying an extra $200, but we're saving more money.
We're saving
But that-
$15 a
But
month.
it is what we're doing.
Right.
Okay.
I look in the corner, this is the part I like if I was a
Yes.
retiree. If you look in the corner, the savings to the retirees, most people are 50%.
Right.
And so they're now paying $200 roughly, and probably paying $250 on January 1st. Right now, they're paying, with this plan, they'd be paying $122. And everybody's struggling, a lot of people are struggling to pay their co-pays on drugs, we heard every day. So, anyway, that's a really nice thing to get.
And we love the network because we have we have a joke around about Conway, South Carolina. There just seems to be where a lot of law enforcement and corrections, both from the counties as well as the state, retire and settle down there. And so to know that we're not dealing with the out of network issues or problems.
We have had a lot of.
Yeah, exactly. So those are things that would be resolved in this as well.
I know, Michael, we've had this discussion, but whatever we send out to our retirees, you need to say, and I know it was your idea, but the Anthem Blue Cross Blue Shield, to mention Blue Cross Blue Shield.
Absolutely, yes.
Because they won't know what just Anthem is.
Yeah.
Right.
We had talked the last time about transition time. And I know you're offering here August 1st and September 1st. Is August 1st doable? Is that enough
60
time?
days. They need 60 days.
So that's enough time.
Yeah, we've already filled out the preliminary paperwork.
I mean, it's
so-
close, but yeah. So was there any reason we wouldn't do August 1st?
Unless she's telling me that there would be a problem with it.
I mean, it's not much of a
Telling me
savings, but any
problem with
savings
it.
as far as, I mean, as long as it seems to work.
It is doable in the 60 days, as you mentioned. You're talking June and July to be able to do it on August 1st. I would think that we would try to do everything we can to get it to that.
To get letters out, we'll have meetings.
So is this part of are retirees, are the unions included in a retiree discussion or not? Okay.
No, but what we would want to do is, we've involved Elena in these conversations as well. And now that we have the final numbers, unfortunately, she's been unavailable over the last couple of days. So we would like to run it by her just to ensure so that she has that information, because she does still get calls from a lot of the reps about it as well. So the plan would be to put a resolution through our next process in order to be able to do this, but we could certainly start doing our legwork that we would need to do. And then as far as that's concerned, we would include her in those calls. So if God forbid there was some sort of problem, it would be brought to our attention before it all went through.
But the paperwork could not be signed until it went through the board.
It has to.
So that's not gonna happen till June.
Of June.
So would we
So
really
should
have
so
enough
should we
time?
look
Well,
at September
Well,
first?
no, that would be July unless you're having a special.
Oh, gosh, right.
So I guess that's
Could we do special before the June board meeting?
That's what you're gonna have to do if you
Yeah.
want it to go
Alright.
through June. Yeah.
Yeah, we can do that. We're gonna have, would be a special finance. So we'd have to refer to finance. Well,
You answer to, the answer
Finance.
to, so you could do it in the next meeting if you want from the floor.
So it seems to me it's gonna be.
we
September.
could do it. Actually, we could do it today.
Yeah. You could do
Well,
it here at 3.
We'll just do it as propose a resolution to accept, and then we can draw it up afterwards.
So then we can still
So it'll
hit
be
the,
August.
yeah, okay.
Thank you.
Perfect.
You guys are
Thanks, Kelly.
confusing me.
You're welcome. As always.
So I guess we need a motion to accept.
I'll make the motion to accept the Anthem plan, for the potential $425,000 savings.
I'll second.
Discussion? All in favor?
Aye.
Opposed? Carried.
Let the record show the insurance committee was dancing on the table.
Yeah. It's recorded,
So was
so
the
get up.
finance.
Climb on.
I'm sorry, PJ's not here. 'Cause that would have been nice.
Great.
Yeah.
Great work, thank you.
All right, well, are you doing them?
Huh?
Are you adjourning? What,
Doing what?
adjourning?
Yeah, so a motion to adjourn?
I so move.
Second?
Second.
All in favor?
Yeah.
Opposed? Carried.
Thank you.